Hello, I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, news feeds, publications, and social media. I would like to welcome everyone to today's CHE partnership webinar, which is titled Leveraging Open Data to Promote Environmental Health, Innovative Applications in Climate Change and Agriculture. Our moderator today is Karen Wang, Director of CHE. We will leave time following presentations for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for our panelists to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Karen.
Great, thanks so much, Maria. Really excited today to bring two great researchers to the CHE audience. First, we're going to hear from Brooke Anderson, who is the assistant professor at Colorado State University in the Department of Environmental and Radiological Health Sciences, as well as faculty associate in the Department of Statistics, with over, preliminary total of $317 billion in damages from hurricanes in 2017 alone, most of which came from Harvey, Irma, and Maria. I think that, we're really excited to hear about Dr. Anderson's methods on how they assess exposure to tropical storms and hurricane hazards, and the open source software that they developed. So very timely, and we're really excited about that. And our second speaker is Joan Casey, who is a postdoctoral scholar at the School of Public Health at the University of California, Berkeley. She received her degree from the Department of Environmental Health Sciences at Johns Hopkins in 2014. All of her research focuses a lot on electronic health records and spatial analysis, and she studied a bunch of diverse things from fracking to noise pollution to what she's going to be talking about today, which is industrial livestock production. She's going to be talking about the links between concentrated animal feeding operations and human infection. So yeah, we're really excited to have both of them. So I will turn it over to Brooke to start off. Thank you.
Thanks so much, Karen. Sorry, let me get everything set up and make sure I'm good to go. All right, thank you for everybody who joined in today. I'm really excited to talk about this topic. I've been leading some research in my research group on how we can assess county level exposure to hurricanes and other tropical storms in the United States, specifically in the context of doing epidemiological research. So for a bit of motivation, there's a growing body of literature that suggests that there can be important health risk associated with exposures to these storms. One area where a lot of this has come out recently is a whole series of studies about the health risk specifically for Hurricane Sandy. This is an image of Sandy. This was a huge storm that came up and affected the northeastern part of the United States, particularly New York and New Jersey. And different studies have come out that have identified an association with increased risk of things like emergency department visits, outpatient waterborne disease cases, particularly among the elderly, myocardial infarctions, hospitalizations, and even just problems with accessing medical care. Tropical storms and hurricanes are really interesting because they're this multi-hazard type of an event. We often think of extreme winds when we think of hurricanes, and a lot of times that's what's forecast and what the evacuation orders are based on. But they can bring a number of other hazards as well, including extreme rainfall, storm surge, flood events, both coastal and inland, and then also tornado events. So an important question then becomes, how do we determine for epidemiological research whether a county was exposed to a tropical storm? Often our health data is at the county level, so this is a really critical question. But since there are all of these hazards, there well could be counties like inland counties that are affected by flood that we might not pick up. So this image shows an example of how people have kind of tackled this in the past. On the left are the names of different studies that have been epidemiological studies of tropical storms or hurricanes. On the right are kind of broad classifications. So there's been a series of studies on birth outcomes, several on mental health, some on mortality, and then a few with other health outcomes. Each of these blocks indicates that that study used this particular metric in trying to identify locations that were exposed to the storm. If it has several different ones going across, that might mean either that the study tested different metrics or that they had a metric that combined both of those pieces. And for some of these, they did sensitivity analysis where they investigated different thresholds. So for example, different distances from the storm track, and that's indicated by how dark or how light the color is. The lighter color used only one, darker colors used more as a type of sensitivity analysis. So I wanted to point out a few things here. First of all, there's been a lot of variety in how people have defined exposure to storms across epidemiological studies. And often it makes sense for the specific study they did, but this makes it difficult to compare results across a series of different studies. Another thing I wanted to point out is that one of the more popular measures is distance. This is one that's pretty easy to measure, but it doesn't always capture exposure well, especially once you start looking at multi-storm, multi-year studies that bring things together. Often this will use an equal buffer from either side of the storm, and for different storms, they can have different widths, and the forces of the storm can be different on the two sides of it. Often winds are higher on the right-hand side of the storm, and then rain and things like that can be more severe on the left-hand side of the storm. Some studies have used specific hazards like wind, and a few have used flooding as well. But you can see some of those hazards that I mentioned, including tornadoes and extreme rain, don't show up in any of these metrics. And then some have used things like damage reports, and these come from FEMA often. There are a few limitations with this. Often they make sense to use, but these are collected based on response to the storm and aren't always ideal for epidemiological research. And also, this is something that you don't know until after the storm, whereas for wind and some of the other types of hazards, you can project that, you can forecast it as a storm is coming. So if we can do epidemiological studies linked to those hazards, it might play more of a role in being able to forecast very imminent dangers from a storm that's getting ready to make landfall. So the aims of this study, first of all, were to develop exposure classifications for all US Atlantic basic tropical storms. We had, for all of our measures from 1986 to 2011, for some they go back as far as 1988 and some as far forward as 2015. Then we assess the agreement between these different exposure classification methods. If they agree really well, it doesn't make too much difference which one we use, and we could use one that's more convenient. And then finally, we wanted to make it very easy for others to use this in their own research. And so I'm going to talk a little bit about how we developed open source software to help ensure that. So we measured exposure based on 5 different metrics, first based on distance, and then wind, rain, flood, and tornado events. So the distance was based on National Hurricane Center best tracks data, and then the wind was based on a wind model developed from a Willoughby et al. Paper in 2006. Rain is from a reanalysis data set called NLDOS2, and then the flood and tornado events are both from a storm events data set that NOAA keeps. All of these incorporate in one way or another these best tracks data. So I wanted to explain that briefly. I've shown an example over here. For all storms, the position and the intensity of the storm in terms of wind speed, maximum wind speed, is recorded every 6 hours as the storm passes. And you can see those markers here. So from that, we could figure out for every county, when the storm was closest to the county, how far away it was. And here I've shown the 6 hourly. We actually went a little more refined from that and interpolated this for 15 minutes to get that distance. But this information also goes as an input into the wind models, which are based on position, forward movement, and then also the maximum wind speeds of the storm. And then for rain and flood events, those are both based on observed data. And so for those, we had to pair them up with these storm tracks to identify the exposures at the time when the storm was closest to the county. And also we wanted to make sure that extreme rain over here, for example, that didn't coincide that coincided in time with that storm didn't get accidentally picked up as an effect of that storm. So for rain, floods, and tornadoes, we also imposed a distance. So to be classified as a storm, you had to have, for example, extreme rain, but you also had to be within a certain distance of the storm track. Next, I want to talk a little bit about how well exposure based on these different metrics agreed. So for each of those metrics, we did a binary classification that was in line with what's typically done in epidemiological studies. And then we looked across the different storms at which counties were assessed as being exposed based on that metric. This is an example for Hurricane Ivan. This came in on the Gulf Coast and affected a lot of United States counties because it kind of came right through the eastern United States. For each of these maps, the yellow are counties that were assessed as exposed based on that particular metric. You can see from this example that there's a lot of disagreement in which counties were exposed based on which metric you look at. For the wind-based metric, you can see here that this is mostly counties that were very close to the coast. This is pretty typical for wind. As the storm makes landfall, the wind speeds tend to decrease quite rapidly in the storm. The intensity of the storm goes down a lot after landfall in terms of wind. On the other hand, for rain and flood, you can see that there are a lot of impacts that go deeply into the United States, and a lot of them are in counties that are well inland. A lot of these are also to the left-hand side of the storm. For tropical storms, a lot of them will dump a lot of rain as they move further north and undergo what's called an extratropical transition. For the tornado-based metric, you can see that this is much more sporadic, where we just have ones kind of spotty through the counties. And also, these tornadoes tend to be on the right-hand side of the storm, and you can see that pattern here for Ivan, where they're in a different location than most of the rain effects. We wanted to look at this across a series of storms rather than just that specific one. And so to do that, we measure what's called the Jacquard index. Here, X1 is the set of all counties exposed based on one metric, for example, distance. X2 is all of the counties for that assessed as exposed for that storm for a second metric, like wind. The denominator of this is all counties that were assessed as exposed by either of the two metrics. And then the numerator is those that were assessed as exposed by both. So in other words, this is out of all of the counties that were classified as exposed by either metric, what percent were assessed by both as being exposed. So this can go from 0 to 1. 1 means that there's very strong agreement between those two metrics, and then values closer to 0 are very low agreement. This shows that value. Each of these cells shows that value, and you can see the scale over here. This is for all storms between 1996 and 2011, with at least 250 counties exposed based on at least one of the metrics. The number of counties exposed to each storm are shown over here on the right, and that goes with this grid scale, excuse me. And you can see here that each column is showing a pairwise value for that storm for a pair of these metrics. First of all, you can see that tornado values don't agree very well with anything. This is because the tornado exposure is so rare and sporadic that it often, you'll get places that are exposed by one of the other metrics that are not exposed by that. As you move into some of the others, you can see that there are a few storms, for example, Floyd and Irene, which both came along the east coast of the United States, where there is pretty strong agreement between the different metrics, including for things that kind of make sense, like flood and rain. However, this is less common than storms where these don't agree very well. So if you look down here, here are a lot of storms in this block as well, where there were lots of counties exposed, but even for some of the things like rain and flood or distance and wind, the Jacquard index, this measure of agreement, is at best moderate for comparing the different exposure metrics. Looking at long-term patterns, you can see this come into play again. This is showing the number of hits per county per decade for all of the counties in the eastern part of the United States for two metrics. The one on the right is the wind-based metric, and here you can see that the counties that are regularly exposed really tend to be ones right along the coast, especially the eastern part of North Carolina and Florida and around Louisiana. On the other hand, for the rain-based metric, you can see that some regular exposures extend well inland, and in some areas they go kind of right up to the Appalachian Mountains. So this is a type of exposure that kind of affects a different profile of counties than what we typically think of for some of these tropical storm exposures. So to finish up, I wanted to talk about a little bit about how we're hoping to be able to share this. So all of this data that we pulled in are from open public sources, many of them created and funded by US agencies. But we clearly did some work with this to pair it up with hurricane tracks and to get exposure metrics that are specific for tropical storms. And we wanted to make sure this wasn't just something that we use in our own research, but rather that it's something that's very easy for other people to use too for doing epidemiological research without needing to have a lot of expertise in atmospheric science to pull it together. So the main thing that we created from this is a package called Hurricane Exposure. This is an R package and it's open source, it's free to use, and you can also go in and look at all of the code for it. This allows somebody from within the R language to query with different calls and to say, for these specific counties, and these are using FIPS codes, I want to identify all of the storms where there was at least 100 millimeters of rain over a 3D period centered on the day that the storm came closest. You can set date ranges, and then you can also set a distance for how close the storm came to the county. And you can see that that outputs a data set of exposures, including these continuous measures of precipitation in this case, that can be paired up with health data for epidemiological research. Along the way, we had to do a lot of pieces, so we tried to make all of that open source as well. So for example, for the storm wind modeling, we based it off a paper written by an atmospheric scientist, but we implemented that in R. And we put that out as a package as well. And this can model county level exposures, but it can also do any kind of location as an input. And this is an example showing Katrina, and it's showing a zip code level for New Orleans projecting to that specific level. We also put out a few different packages. Two are called County Weather and County Floods. These both sit on top of other packages that let you access data through what are called APIs on NOAA and USGS. APIs essentially let you get the data that they want to share with you in a more convenient way without you having to pull everything to your computer and sort through it. You can put in queries for exactly what you want. These packages allow you to do that while querying at the county level, which again is often the level that health data is available. NOAA Storm Events pulls data from the NOAA Storm Events database, and then County Time Zones lets you kind of coordinate health data that's in a local time with weather data that's measured in UTC. In our continuing work on this research, one of the main things we're doing is our own epidemiological study, and this is being led by one of my PhD students. And this looks at the association between mortality outcomes and exposure to tropical storms. These are examples from Hurricane Andrew. You can see on the right, these are risks associated with the storm for accidental deaths, and this is compared to matched days that are otherwise similar but did not have a storm exposure. And you can see there's a large increase in risk there. That's not too surprising. What's maybe even more interesting is if you look at total deaths, there's a very evident increase that lasts a few days associated with that. And some of these are coming from causes like cardiovascular deaths. We're finding this kind of pattern, but only for the most extreme storms. So some of our continuing work is kind of what are the characteristics of a storm where you start to see these patterns of increased mortality for a variety of causes. So I'll finish up there, but I just wanted to put up some acknowledgements for the funding behind this, and also a slew of collaborators helped out with this, including some students in my research team, and also people from a variety of fields to help put together this exposure data.
Great, thank you so much, Brooke. Next we have Joan presenting her work.
Hello, everyone. So nice to have you all here. So let me share my screen. Here we are. So thank you, Brooke. That was great. I will now go on to talk about the ag portion of these slides. First, I'll just give you some background, some CAFO cliff notes, if you will, some history on hogs in the United States. Then I'm going to talk about some of my work with antibiotic-resistant staph infections. And then finally, I'll go on to talk about Senate Bill 27, in California, which is related to the use of antibiotics in agriculture. So last year, the New York Times did a really interesting piece on ag in the US. And so I wanted to show a few pictures from that to give you a sense of the scale of some of these operations. So here's a veal calf farm in Wisconsin. This is a turkey farm in Iowa. And here we have a cattle feedlot. So how did we get here? Back in the 1960s, we had a lot of pig farms, and there were just a few swine living on each of those farms. And then over time, we've shifted such that we have many, many swine living on each farm, but far fewer farms in the United States. Just to give you a sense of the vast size of this, in August of 2016, we slaughtered 803 million chickens, 10 million hogs, and nearly 3 million cattle. And most of these animals were produced through industrial food animal production. So this is a type of system that's characterized by high throughput methods that operate on a single site under very highly controlled conditions to produce these uniform consumer products that unfortunately operate under really small profit margins and oftentimes are involved with antibiotic use. So why use antibiotics on these large scale farms? First, therapeutically, just like if you or I had strep throat, we'd go into the doctor and perhaps get an antibiotic prescription so that our illness would go away. That does happen through veterinarians on these feedlots, but then the more prominent use is subtherapeutic, and that comes in two main flavors. The first is for disease prevention. These animals are raised in really crowded conditions, and so using antibiotics can prevent them from getting sick. And second, for growth promotion. So back in the 1950s, farmers realized adding subtherapeutic antibiotics allowed their animals to gain weight faster, and therefore they didn't have to use as much feed for their animals to reach market weight. So since that time, subtherapeutic antibiotic use has gone on. Here's how much use we're estimating is going on in the United States by human medicine versus in livestock. Livestock uses are about triple that of what's going on for human medicine. So this is not an insignificant piece. One, we don't have a lot of new antibiotics coming online, and two, it can create conditions on these farms that might lead to infections in people nearby. So these farms often have bacteria. Some of it is resistant to antibiotics. When we introduce antibiotics, it kills off the susceptible bacteria. That can lead the resistant bacteria to grow and take over and share resistance genes with other bacteria on the site. These bacteria can then move from the farm nearby through either crop field manure application on flies or through the air, potentially exposing people. Some of the first indication that this livestock antibiotic use might be a problem for human health came out of the Netherlands in the early 2000s, when it was found that swine farmers were colonized with MRSA at about 760 times the rate of patients admitted to hospitals there. So a huge difference. This led us to wonder about people living near these operations that weren't actually working there, and if they were potentially at an elevated risk for an antibiotic-resistant infection. So to do some of this work, we used health data from the Geisinger health system in Pennsylvania and their electronic health records. And then to learn about the locations of the livestock operations, we used information from the county conservation districts and Department of Environmental Protection in Pennsylvania in the form of nutrient management plans. And I'll talk about those in a moment. So Geisinger is located in central and northeast Pennsylvania. It's a pretty nice place. It's also a good place to do research because they've had this electronic health record in the outpatient setting since 2001 and the inpatient setting since 2005. So we were able to look back in time and look at the relationship between where people lived and where these livestock operations are located. So the first thing we did was just looked at the amount of MRSA infection, this antibiotic-resistant staph infection in this population. And what we saw was about 1,700 cases of community-associated MRSA, and the rates of community-associated MRSA appeared to be going up over time. So CA MRSA, community-associated, is just the type of MRSA among people living in the community that haven't had a healthcare exposure. So they're kind of a unique, otherwise healthy group. So then we wanted to link to livestock production and see if these folks were more exposed to swine and dairy production in Pennsylvania than others. So we needed to learn where the hogs were located in the state. And we also needed to learn where the hog manure was being spread on crop fields. So to do this, we used nutrient management plans. Concentrated animal feeding operations are regulated as point sources of pollution by the Clean Water Act. And in Pennsylvania, under Act 38, there are some additional farms that are regulated by these plans. And so they're developed because these operations produce so much manure that they need to have a plan of where to spread it. Otherwise, too many nutrients get into surface waters and can get down into the Gulf and cause algal blooms and other problems. So I went around the state and looked at these plans. They provided information about the types of animals on the site, where they were located, how much manure was being produced, and where it was going. They also included some neat maps to show us where the farms were located, as well as the crop fields. Sometimes even hand-drawn maps showing the locations of the fields and farm. And they always told us how much manure was being produced and when it was being shipped off the site. So in order to link this exposure to humans, we needed to know some things about the livestock operations. That was the address of where they were located and the number of livestock on the site. So we could use these aerial photos in the plans, and I could go on Google Earth and actually locate the farms. We then would figure out the distance between each of the farms and the people in our study, and we would weight the farms that were located closer to the people and that had more livestock more heavily towards that person's exposure. We also wanted to learn about crop fields, and for them we needed to know their location, the acreage on which manure was being applied, and also the volume of manure being applied on those crop fields. So here we had to use 3 different methods in order to figure out where the crop fields were located. The first was when the nutrient management plan contained an aerial photo or map. And in that case, I could just go on to Google Earth and draw an outline around the crop field location, and we knew where it was. Great. In some cases, the plan only gave us an address, in which case we would go into Google Earth and drop a point, and then we would create a circular buffer around that point equal to the acreage that we knew the manure was being applied to. Then in the third method, when we only knew the township and county to which the manure was being exported, we used a land use land cover map, because we know in Pennsylvania that manure can only be applied to cropland, pasture land, and agricultural land. So we would go in to the township that we knew the manure was being sent to. We would randomly select a pixel of that yellow crop, pasture, or ag land type, and then create again a circular buffer of acreage that we knew the manure was being applied to. Then we used a similar inverse distance weighted exposure where crop fields located closer and with more manure were contributing more to the participants' exposures. So then we went on to do a whole epi study around this that I don't have time to get into today, but if you're interested, you can check it out. The takeaway from it was that living near denser and more manure-applied crop fields and livestock operations was associated with increased odds of having one of those antibiotic-resistant staph infections in the community. So shortly after this study came out, the US FDA released this voluntary plan to reduce the use of antibiotics in animals. So it had a big loophole because it banned use for growth promotion, but it permitted routine use for disease prevention. So essentially, with semantics, farmers could go on using antibiotics in the same way they had been for a long time. Just like you might expect a voluntary plan to not be incredibly effective. So kind of exemplified by statements like this, we do not see this announcement being a material event. Okay, so farms self-regulating on antibiotic use hasn't worked. The nationwide voluntary plan was sort of a bust. So what about food industry-led efforts? I guess I should probably actually call this consumer-driven efforts because consumers are actually demanding organic products and products raised without antibiotics. So there are some leaders in this in Chipotle and Panera that don't serve any products that have been raised with antibiotic use. And this is kind of a growing area. And these industries aren't doing it out of the goodness of their heart for the most part. It's because of this consumer demand and folks being willing to pay more money for these products. So that's a potential avenue. And what about state-based policies? So California has an opportunity to lead here. In 2015, Jerry Brown signed Senate Bill 27 into law, and it's actually going into effect very soon on January 1st of 2018. This bill prohibits antibiotic use for growth promotion, which is great. And then it gets a little more complicated. So it does in fact allow antibiotic use to treat sick animals or control infection in sick animals, which makes sense. No one's arguing that we shouldn't treat ill animals. Second, the bill allows antibiotic use to prevent infection if disease risk is elevated. This is where things get a little murky because the bill doesn't allow regular pattern use. So we can't just be using subtherapeutic antibiotics all the time. But in cases where in a herd disease risk is elevated, antibiotics could be administered. So we're very hopeful that this is going to dramatically reduce antibiotic use on farms in California. And the great part is that any antibiotic use, in fact, requires a veterinarian's order. So that will enable us to track the type and pattern of antibiotic use after this bill goes into effect, which in itself would be a great contribution because we really don't know much about antibiotic use in the US, and so that has really hindered any research. We know the total volume that's sold, but we don't know the types of antibiotics that are used in specific species. So this is a big step. So this is the first legislation of its kind in the United States. It provides some great opportunities. We can look at the effectiveness of the implementation will be really important, economic implications and how we might be able to translate this to other states, and also how this impacts the health of both animals and humans in California. All right, so with that, I will stop there and take questions.
We have a couple of questions. First, for Joan, we had a question from a participant. What is the most common route of exposure for humans to these sources of antibiotic-rich manure? Is it direct skin contact, eating crops fertilized with the manure, breathing the air from person to person? Could you tell us a little bit more about that?
Okay, is there a select all of the above option?
Okay.
But really, it's a great question. We don't really know the answer to that. Probably the strongest hypothesis right now is it would be for adults, probably through air, because these bacteria have been isolated downwind of these livestock operations and near crop fields. But for children, it's very possible that if kids are playing outside on the ground, that it's actually through earth to skin contact. But this is an area that we need to learn more about.
Great. And I actually had a question about SB 27. is there a monitoring and enforcement mechanism for the bill?
So there should be. The state veterinarian is actually in charge of this program where they're going to monitor what's going on. The problem right now is, so there's these veterinary feed directives. Anytime antibiotics are used, one of these needs to be filled out. Those right now are voluntarily given to the state for the public to view. And so there's no mechanism currently that will that's very transparent for the public to be able to track use. But at the state level, in a confidential manner, I believe there is tracking in place. But we're working hard to try to get this opened up even further.
Great. Brooke, I had a question for you. You mentioned some of your research is looking at applying these models to mortality outcomes. Are there other health outcomes that you think would be particularly interesting to look at?
Yeah, we're actually planning to do some research after this looking at hospitalizations among Medicare beneficiaries, which I think could be very, very interesting. But there are a whole number. I think that the field of research is really interesting, in particular on some of the mental health outcomes following storms, because clearly if you have a very destructive storm, there can be a lot of issues with stress and all of that. So I think that that's one area that is particularly interesting.
Joan, didn't you recently write a paper on climate migration?
Yes, I did. And the importance of social ties in making migration successful for both people that migrate and people that are left behind in places of origin.
Oh, interesting.
Yeah.
Brooke, I had another question. So the models that you used were applied to through what year? 2000?
It depends on which hazard we were looking at. For the rainfall, some of the reanalysis, we only had rescaled to the county up to 2011 right now, but for a lot of the others, we have all the way through to 2015, and I actually need to go in and rerun. We can do 2016 now that season is completely over. So for anything that does storm tracks, normally those are available within the year after, kind of a complete version of them. And for some of the different databases, like the NOAA database, all of that information tends to be available fairly quickly after.
Yeah, because I'm sure that people are going to be very interested in looking at exposure from the hurricane season this year.
Yeah, we actually, for the county floods package, I was just looking the other day for a grant report at kind of the downloads. You can get download statistics from CRAN, and it looked like some of those downloads increased a whole lot this fall, which might have been linked. I don't know, of course you can't figure out exactly why, but my speculation is it might be linked to to all the flooding in Houston. People might have been trying to explore that with the tool.
Yeah. And then I had a question kind of for both of you guys. So, the reason we paired you together is because you're both using sort of innovative spatial, analysis for exposure assessment, in different areas. Could you guys talk about like other areas in which you think these similar methods might be really useful for environmental health research?
Do you want to start or should
Sure.
I?
I'm happy to go first. Yeah, I think one of the great tools of having some of these open source data are actually how fast we can start studying events. So when we have, for instance, in Brooke's case, a hurricane this fall, pretty rapidly, we should be able to look at a relationship, whereas before it might take a lot longer to aggregate data. And another interesting thing I've been working with is Google data and using search data to try to actually get at the outcome side. So thinking about how you can use social media or internet searches to actually track population health and how people are feeling in the moment, rather than having to wait for many years and a cohort study to be developed in order to track those health outcomes. And so it can maybe give us a better sense of how a population is doing across a wide geography rather than in a single location where we have a study. So some of these data sources are fairly promising, I think.
Yeah, I would add to that. I think it's really amazing recently how many government agencies and things like that have started making APIs and web services to make their data more easily available from kind of a scripted programming language perspective. And that can open up big studies where you can efficiently pull and look at a lot of that data. And there are different folks around who are trying to make that even easier for people who don't necessarily know all the programming themselves to go in and do it. So one example, there's an organization that I am not like part of this, but I've participated with some things that they've done, and it's an amazing organization called Our Open Sci, and they try to support people who are writing packages that wrap some of these open APIs and do other things to help make it easier to do open science in the R programming language. And among the other things they do peer review for some of those packages. So people can submit a package and other experts in the programming language go through and kind of really make sure it works and it's well documented and all of this other stuff. So I think organizations like that and any efforts like that to try to make these data sources a little bit more available for the person who might know a programming language like R enough to use it, or Python, but who wouldn't necessarily feel comfortable doing it themselves. I'm hoping that that'll really kind of open up, especially for environmental health, some of the larger scale studies you can do.
Great, that sounds really exciting. Do you guys have any questions for each other, or?
I actually had a question for Brooke.
Yeah.
So it was really interesting to see the overlap or lack of overlap in all the dimensions of hurricanes that you measured. So, but I was thinking about then, how do we study the exposure of hurricanes if they're so heterogeneous?
Yeah, well, some people have tried to kind of put together an index that would bring in different pieces of this, but I think it's useful to have each of those strands by themselves to do research, and then for a particular outcome you can look at, oh, it looks like this is really associated with flood exposure, or maybe this is something where if you either have heavy wind or you have heavy flood, you can get a problem. So I think that we could move towards indexes for kind of specific outcomes, but I think it's really useful for researchers to have access to all of those different facets of exposure when they're doing their initial research, for sure.
Yeah, especially if you want to go in with an intervention afterwards. It seems like depending on what type of hurricane it was, you could have a very different set of folks sent in.
There's actually, you know, I work some with some people who model power outages during hurricanes, and they use those same kinds of wind models coming in. And then I'm trying to remember which organization, one of the national agencies does something called Empower that maps Medicare beneficiaries in each, I think you can get down to zip code, and it also has the number that are reliant on electrically powered devices. So you can get a picture kind of immediately of where there might be high risk. And then when you pair that with something like modeling of where power outages might happen, I think that's a very powerful tool for response, for sure. I had a question for you too.
Sure.
So the work that you did in Pennsylvania, how do you have any plans to expand that out to other places, and how difficult would that be? Are those systems very like state dependent on how they report stuff?
Yes, both on the health level and the ag level, but Pennsylvania actually, because they have this Act 38, they have a lot stronger collection of these plans than a lot of other states where we've tried to identify livestock locations. But we actually have an ongoing study evaluating the impact of SB 27 here in California. So we're going to look at the profiles of antibiotic-resistant bacteria on meat that we purchase at the grocery store before and after. And then we're also partnering with some big health systems out here to look at antibiotic-resistant UTI before and after this bill goes into place, and try to see the overlap between the meat products and the human infection pre-post. So we're hoping to be able to get some really good data, but it is more challenging in places that don't have as centralized collection of those plans about the ag as Pennsylvania does.
That sounds really interesting. Great. Okay, well, thank you all for joining us today. And Maria, I'll turn it back over to you.
Okay, thank you so much, Karen. We are approaching the end of today's webinar. A video recording of this webinar will be available on the CHE website soon. Tomorrow you will receive an email containing a link to the video. CHE's next webinar from the CHE EDC Strategies Partnership will take place next Wednesday, November 15th, and is titled Melamine, Scoping Review Reveals Potential Endocrine, Reproductive, and Neurotoxic Activities. To learn more and to RSVP, please visit our website at healthandenvironment.org. CHE's next webinar in our 20 Pioneers Under 40 in Environmental Public Health series will take place Wednesday, December 6th, and is titled Environmental Health 2.0, Engage Communities and Strengthen Partnerships. Details will be available on our website early next week. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers once more for taking the time to present today, and Karen for her excellent moderation. Thank you very much for joining us, and have a good day.